Welcome to First Star Let's Chat, an athletic therapy podcast. I'm your host, James Gardner, certified athletic therapist, certified strength and conditioning specialist, yoga instructor, human being. This platform, for the pros, by the pros, anybody in the performance space, and beyond. Welcome here to share in the stories of professionals, experiences, journeys, learning along the way. It's a platform to connect, to network, and to be a part of a community that cares, with conversations that matter, experiences that resonate, and generate ideas, thought-provoking, organic dialogue, passionate pros. Brought to you as always by First Star Therapy, Mobility Tape, IPEC, and Benchmark Athletics, in association with the Canadian Athletic Therapists Association. It's First Star Let's Chat, an athletic therapy podcast. Thanks for being here. Thank you for being a part of it. All right, we're back. Let's Chat, an athletic therapy podcast, the official podcast of WFAT. Looking forward to meeting Dr. Anthony Breitbach in the future here in Dublin in just a couple of weeks. Thank you so much for your time, for being here. I'll read through your bio and then we'll jump in on how this all fits. Dr.
Thanks,
Anthony,
James.
Yeah, no, awesome.
Thank you, James. Appreciate it.
Great to have you. Great to have you. Dr. Anthony Breitbach is a professor and director of interprofessional education at St. Louis University. He's a distinguished fellow and president of the National Academies of Practice, representing NAP at the National Academies of Sciences, Engineering, and Medicine Global Forum on Innovation in Health Professional Education. Dr. Breitbach is an Association of Schools Advancing Health Professions Fellow, chairing their Interprofessional Committee, and represents them on Interprofessional Education Collaborative, also serving as Deputy Chair of the Interprofessional Global Board. Anthony is an associate editor for the Journal of Interprofessional Care and the Journal of Interprofessional Education and Practice. Officially, over to you. You've done a lot. You've completed a lot. You're a part of a lot of things, and I think this has a lot of resonance with World Congress coming up, WFAT, and what you're doing and how it connects to athletic therapy and training.
You know what's funny is I just celebrating my 40th year as a certified athletic trainer this year. So I was certified in 1985, and I look back about the 22 years I worked as a clinician before I became a faculty member and became engaged with some of these organizations. And I really view the mindset that we have in athletic training and athletic therapy really has served me well. We're always looking to provide value to organizations. We're always looking to make a difference, whether it be for our teams and whether it be for our patients or our clients or their families, So I think it was something, this growth that I've experienced over my career is really just an extension of my journey that I've been on as an athletic trainer and as a faculty member. And I really value those foundational values and that work ethic and those skills that I acquired all the way back when I was a student at the University of Iowa and the University of Florida.
Amazing, an amazing capture, and to sort of build off of all of that to where you are now. Maybe we'll just chip our way at working backwards, and obviously what you're presenting and how it's going to be utilized in Dublin. Interprofessional education at St. Louis University, is that within? I mean, what does that encompass? Does that encompass athletic training students? Does that branch, different faculties and things like that at St. Louis? And then how does that play? I guess how does that play out?
Yeah, so our interprofessional education at St. Louis University has actually been around since 2006, and it really incorporates. It has an undergraduate concentration that's actually embedded into the curriculum of four different professions: athletic training, physical therapy, occupational therapy, and nursing. And what happened was when I came to SLU, I really wanted a vehicle to be engaged in an institution where I could get my PhD. I went to SLU in 2000 to become the head athletic trainer. and worked on my PhD while I was the head athletic trainer at St. Louis University. I finished up my PhD in 2007, right when SLU was starting an athletic training education program. So when I transitioned over to be the director of this brand new athletic training program, we didn't have any students yet. So what happened is the faculty that were leading these interprofessional education initiatives were like, hey, we need faculty resources to help teach these 3 courses. And so I jumped in and I started teaching those courses. And as I was teaching these courses, I'm like, wait a second, this is the way I've delivered care my whole life. I mean, you think about the first thing you do as an athletic trainer or athletic therapist, you jump in and you create a network of providers that you can work with to take care of, whether it be nutrition or psychological aspects, orthopedic surgeon, if you need primary care physicians, those kind of things, physical therapists, occupational therapists. So the reality is that the light bulb went off in my head. It's like, wait a second, this is not a part of our normal curricula and our normal mindset nationally in athletic training. I really became an advocate for that. So I got a chance to be a part of the NATA's Future Directions in Athletic Training project. And in 2012, we put those out. And one of the things that we put out we put out a recommendation that interprofessional education should be part of all athletic training education programs. And I started writing a white paper brought together 23 authors and led a white paper on that concept, and really have worked hard to be a real advocate for the athletic trainer's place, because that paper was really designed to not only inform our profession about interprofessional education and collaborative practice, but also inform others about you should have athletic trainers at the table when you're designing these initiatives. And many times we were kind of left on the outside because, many times our programs weren't in schools of medicine and schools of health professions and stuff. We were in education and in kinesiology and those types of things, which often, aren't at the table when these types of things are being designed. So we, I really have worked hard over my career. Number one, building awareness of athletic trainers and athletic therapists. Also really advocating for more scholars coming up as athletic trainers. And I've been lucky to be on a bunch of different dissertation committees, have a bunch of different co-authors. So, and I've gotten involved with WFAT. We actually, I spoke the last time we were in Dublin on this topic, and we hosted the World Federation of Athletic Training and Therapy World Congress at St. Louis University in 2015. I've also, I'm lucky enough to have become the chair of the International Committee for the CADE, the accrediting body in the United States for athletic training. And that brings us to what our topic is going to be in Dublin, is we are going to really talk about many titles, one shared purpose that we have. We all have shared values, we all have a shared purpose, but we, because of the different titles in all these different countries, we don't think that there's a real brand awareness internationally of the athletic training or athletic therapy professions when you go from country to country. And one of the things we just want to talk about is we're going to have a forum kind of workshop where we're going to sit around tables and we're going to leverage the shared expertise in the room and have people talk about what are the problems we're facing, how can we work together to overcome those problems. And we're really going to lead a discussion knowing that there's a lot of experts in the room at the World Congress. So hopefully we'll come up with some ideas on some recommendations we can do to move forward to elevate our professions globally in some of these countries that maybe we don't have the presence that we do now. And I think we're really excited about engaging with our colleagues in Dublin at the World Congress about this topic.
Yep. Right. Love it. Terrific. Amazing capture. Congratulations on your recent 40th year as an ATC in the US there. That's a massive accomplishment. And again, sort of drawing off of that experience, right? Half of that, if not more, on the ground, in the clinic, on the sidelines, doing the things, and that's informed how and where things go. And near and dear to my heart is this piece of, you know, 4 professions within St. Louis University, and you have yourself sort of at the forefront guiding this. And I think that's one piece of the profession that not a lot of people know, and I think it's a bit of a humble brag that we can kind of fit in anywhere, and there isn't really a desire for ego to be at the center of it, but more to just be a piece of the thing that helps everything else work: patient care, team function, management, you know, strategy, rehabilitation, strength and conditioning. Like, there's a pliability to this profession, I think, that is allows itself to lends itself to be sort of involved in interprofessional education and interprofessional, like, have a voice at the table. So much to capture based on what you've said, but that's kind of my takeaway on that, and that's a big piece on having this podcast. And it's not to say, wow, look at us and we can do everything, but it also is to say that, because I think there's a niche and there's a fit in there kind of across the board.
Yeah, so I think, you know, one of the things I tell athletic trainers and athletic training students when I talk to them is something that's really needed within our system, really dramatically, is care coordination. I think there's many times a lot of professions are really, they're so focused on, I want to be the best physical therapist, I want to be the best physician, all that kind of stuff like that, but they don't necessarily have the mindset of care coordination, whereas athletic trainers have that, or athletic therapists have that mindset from when they're a student in college, right? Like, we're always thinking about, how do we pull the team together? How do we work together better? And that is such a valuable, transferable skill set that you bring to the medical team, wherever you're at. You look at, you know, where athletic trainers are starting to move into physician offices and those types of things like that. The reason why they are is because they're care coordination experts. They know that, number one, you know, if a physician practice hires an athletic trainer to work in a physician practice, they can wear a lot of different hats. They understand the medical side of it, but they can also coordinate the administrative side of it, and they can they're really used to communicating with parents and families. And you think about what athletic trainers do in their, you know, our students in athletic training education, they communicate more with patients and families than probably any other groups of students that in their academic preparation, because we're always communicating with stakeholders and our patients about their goals and about the treatment plan and about, you know, finding ways to, you know, be compliant and play or no play decisions, all those types of things that we have a lot of practice doing, and that the system needs that skill set. And so we need to kind of own that skill set, that care coordination, because I think that is really the secret sauce that athletic trainers bring to medical teams.
Brilliant. Again, brilliant capture. And I think, like, that summarizes a lot of, at least my thought process. So, like, there is something different about what and how we do things. What is it? But that coordination of care, communication with administrators, right? And just thinking back to my professional career with professional sports teams, it's like, you're hearing and talking to all these people, but you also have to understand how to disseminate information to and from an athlete, to and from a coach, with other players in the room or in the environment. So a lot of skills there. You mentioned you've been at WFAT, you've hosted WFAT St. Louis. How much has it changed, and do you still get excited about it? I mean, I think we've had a couple guests on, and obviously you're passionate and driven and doing a whole lot of amazing work that you want to share and continue to build. Do you look forward to the World Congress, the in-person component of it, or being able to present? I mean, you've already mentioned collaboration and expertise. Leaning on expertise is, I mean, to me, this is a no-brainer, especially in a different part of the world where you get a little bit of travel out of it as well.
Yeah, you know, I'm a huge, in my work with Interprofessional.global and you know, WFAT and the Katie and all those types of things. I do get the chance to travel internationally. Also, St. Louis University has a physical campus in Madrid, so I've been there a few times. There is no substitute for being in person, especially when you're working across cultures. It's so much, you know, you can efficiently meet on Zoom and those types of things like that, but there's that immersion in a culture that and being face to face and and interacting socially with your colleagues that you can't get that on a remote platform. You just really can. And so, you know, there's the ability to really build friendships and develop opportunities. One thing I'm really excited about how WFAT has evolved is there's a lot more students that are looking to come to this. Like, you know, I was part of the academic institutions committee for WFAT. And before I started doing a lot of the stuff with the Katie, because it was just hard to do both things, you know, and we're really building a lot of student exchange interest, which is really, really important. So at St. Louis University, we've had an exchange with it used to be Athlone Institute of Technology. Now it's TUS Athlone from Ireland, and then we had a exchange program with University of Camilo Jose Cela out of Madrid. And I always felt that when one of your students studies abroad, it benefits one student. When you have students from other universities come to your institution, and like I always would insist on them, you know, going to class with our students and being on clinicals with our students, because that different mindset and that different cultural perspective they bring to your campus benefits all of your students in your program. So that I think WFAT is doing a really nice job of nurturing that kind of student intercultural exchange, international exchange programs, and that will only create greater understanding, create a better sense of a global identity for the athletic training, athletic therapy professions. Once we start to realize all the common values we share and some strategies for, you know, elevating our standing, you know, whether it be in Ireland or Canada or the UK or Japan or Hong Kong or those types of things like that.
Yeah. Amazing. And we had a couple students on, a recent grad in Ireland and then a current student in Ireland. And you know, the last World Congress had a huge student presence there. There's a lot of extra energy in the room and drive, and it kind of reminds yourself of, you know, why I'm doing what I'm doing. There is a future here in this profession. There's also all the experience that I have gained and want to give back to the profession. Clearly, this is the case, you know, with yourself and all the channels that you're operating in currently. Plus the opportunity again to be in person and immerse in culture, whatever our take is on what that culture is. You know, maybe we'll do one of the things that we talked about off
Exactly.
whether that's break bread or pour a beer,
or tip a pint. Yeah.
tip a pint or break bread. But the opportunity to do it in person, and this year's WFAT seems to have this very compact agenda for educators, for professionals, and then for students as well. So sort of three simultaneous streams where I don't know if there's enough time, but hopefully people can utilize the social time, the breaks in between, to sort of catch what's going on in all of the venues and all of the speakers. It looks to be a terrific lineup. Again, Dr. Anthony Breitbach with us from Breitbach with us from St. Louis University, and doing all of these amazing things in capturing and collecting education collaboratively within the profession and from within the profession outwardly and receiving other professions. Yeah, listen, I don't want to take too much of your time here, but I really appreciate you carving in the time to chat with us. Anywhere else you want to take it before we go, I'll leave it sort of to you and run with it. You've done this for a long time at a very, very high and distinct level that I think other people will need to hear about. And I'd love to have you back on in the future after World Congress.
Yeah, I know. I think I'm so thrilled for the opportunity. I'm thrilled to meet you in person. I really appreciate everything you do to promote athletic training and therapy. You know, one of the cool things about this year's World Congress is the fact that there's a social session at the end. A lot of times where it's kind of the celebration of the time we've spent together. So many times you go to meetings and all the stuff is kind of front loaded or middle loaded, and then people just start trickling away. You know, and at the end, you're just kind of going home, you know. Now it's like we're going to celebrate the time we spent together, everything we accomplished, reestablish our friendships, making sure we know how to contact each other, all those types of things like that on that Saturday night before most of us head home on Sunday or Monday or whenever we're heading home. So I think it's a well-designed Congress. It creates a lot of professional interaction. And then we have kind of this social kind of celebration at the end, which I think would be pretty amazing way to kind of seal the deal and leave with a real positive sense of unity across our professions. And I think it'll be really an excellent opportunity.
Yeah, I'm looking forward to it. Look forward to shaking your hand, tipping a pint in person, whether that's, Tuesday, Wednesday, Thursday, Friday, or Saturday, or all of the above, depending on the situation.
Sounds great.
Yeah, again, Dr. Anthony Breitbach from St. Louis University, thank you so much for all you're doing for the profession, for everything you're doing with your passion, your drive, and gaining all of that experience along the way to share with us. Look forward to seeing you in just over 2 weeks now and getting things rolling there. To our listeners out there, please feel free to reach out. Dr. Breitbach will be back on again, I hope, either in Dublin or following Dublin, but a resource for all of us is I don't know, it's invaluable. It's great. And I hope that we can get more of your work and what you're doing in St. Louis and outwardly to our population and outside of our profession as well. So thank you so much. Your words just to close it out, but to all of our listeners, thank you. Keep tuning in.
Yeah, thank you. And on safe travels. And just like you said, I am so willing to connect with anyone in our profession. So I hope like my contact information will be in your notes and connect with me on LinkedIn or one of those types of things like that. I'm really more than happy to lend a hand whenever needed. And, James, safe travels. And looking forward to seeing you in Dublin.
Outstanding. We'll see you there.
Take care. Bye-bye.
Thanks again for being here. Thanks for listening. Thanks for being a part of this community. Check us out online, firststartherapy.com. That's FIRSTAR therapy.com. Or email us with feedback, consult@firststartherapy.com. CONSULT@firststartherapy.com. On Instagram @firststar.therapy, and our podcast host @letschat.at. This is First Star Let's Chat, an athletic therapy podcast.